With just 5 days until the legal requirement to wear a mask comes to an end, a North East scientist has criticised the government's plans, describing them as premature and warning it will put more young and vulnerable people at risk. It comes as hospital admissions are rising with COVID patients across our region. The North East has 8 out of 10 of the highest infection rates in England, with South Tyneside at the top of the table with more than 1,300 cases per 100,000 people. But despite the change in law, the government says masks are still expected and recommended in crowded indoor areas. Well, earlier I spoke to Dr. Sterghios A, Professor in Cellular and Molecular Sciences at Northumbria University. He told me he thinks it's too soon to go mask-free.
It's really unclear what on earth the government are trying to achieve by doing this. There's a significant proportion of society that does not seem to understand how, for example, masking or maintaining distance is actually going to prevent the virus from transmitting. And they're going to just feel that they've got carte blanche to do whatever they want. There are another part of society that don't care about their peers and their friends and their colleagues and their families, and they're just going to be putting them at risk. Sage has asked for what is the plan the government are going to have in case they're making a mistake to rectify it. Well, there's been no response.
The government has said that masks are still expected, recommended in crowded indoor spaces. Is that not clear enough?
Well, if you ask the Board of Transporting Companies that today announced that masking is not going to be obligatory, clearly that's not passed across enough. Anyone that has a business has the capacity to say, in my business, you have to follow these rules. Otherwise, see you later. Go try another business. They should be doing this if the government are saying they should be doing this. Instead, they elect not to. We're already seeing the consequences of the poor messaging the government, again, are using in this pandemic.
There'll be people watching who've had 2 vaccinations now and are probably thinking, well, I'm going to go mask-free because I've got my protection. From your point of view, what's the problem with that? So
first of all, the majority of vaccinations in this country are with the AstraZeneca vaccine. The AstraZeneca vaccine has good personal protection in the 60 to 70% range if you've been double vaccinated and had 2 weeks to go past. But that still leaves a good fraction, 3 in 10 of people, that will get symptoms and disease. The second problem that we have is that whilst transmission is reduced, it's not eliminated. So these people who are walking around mask-free, they're actually potentially transmitting the virus to the vulnerable, to the unvaccinated, to the young.
Dr. Sterghios A speaking to me earlier. Well, the government scientists have defended the decision to remove restrictions next week, saying that if they waited until the autumn, it could make things worse with flu and other viruses circulating.